You actually took a blood test last week.
Yes.
To test for diabetes.
We had a young lady who had type 1 diabetes, and so that's genetic, and so she's living with it. She had an insulin
Isn't
pump.
she like 9 or something?
She was young, yeah, she was very young, maybe a little bit older than that, but discovered when she was a young child. And so it's interesting that they can live with that and live very productive lives. That was the thing we noticed from her.
When, health officials also want to get the word out that parents should know about juvenile diabetes, and Manolo gets some help from our friends over at UHA and the Juvenile Diabetes Research Foundation in this morning's Catching the Wave to Better Health.
Well, we're talking about, there are 2 types of diabetes out there, and here to tell us about it, we have from the UHA Chief Medical Officer, Dr. George McPeters, and we also have from JDRF, Chandra Kim. I'll start with you, Doctor. What's the biggest difference? What's the main difference between type 1 and type 2?
Well, type 1 we typically associate with children, although there are adults that have type 1, and many children with type 1 live long into adulthood. Type 2 is an acquired disease, typically related to insulin resistance. The body makes the insulin, but the body becomes resistant to it, often as a result of excessive weight gain. Type 1 is a deficiency of insulin. Your body sort of runs out of it over time.
Type 2 is more common.
Type 2 is much more common, especially in Hawaii.
Chandra, you are with JDRF, I guess deals with more of the type 1.
Type 1.
And in yourself, it's you deal with it personally because is it your daughter?
My daughter. My daughter has type 1. She was diagnosed at the age of 7, and she's 11 now, so we've been dealing with this for about 4 years.
How's she doing?
She's actually doing well. She's a very active girl. She has her ups and downs with her management of diabetes. It's a 24/7 disease. It's not something that we can take a vacation from, so it's every day.
What should parents know as far as, what are the signs for type 1 diabetes?
It's very flu-like. So when your child starts to complain of stomach aches or just feeling very lethargic, drinks a lot of water. And in Hawaii, it's very difficult because, it's hot here. So we have to drink a lot of water anyway, but it's something that if you find it very excessive, and through the drinking of water, they may wet their beds at night. A strong sign is a fruity smell on their breath. And that's because there's so much sugar in their body, because their insulin is not being created. The insulin is not being created in their body, so it's the sugar staying in their body.
Unexplained weight loss?
Unexplained weight loss, yes.
Okay, that's another sign right there.
Very thin.
And in the case, as far as once, you're saying a lot of times it goes undiagnosed. Sometimes the doctor doesn't realize that it's...
Well, you have to take a blood test in order to determine your glucose level. And if they don't order that blood test, they could easily go away and say, it's flu-like. In my daughter's case, he thought she's a very thin girl, so he thought she just needed a more carb-heavy diet, which would have been detrimental. If we didn't find out she was diagnosed, when she was diagnosed, it would have been detrimental. Her sugars would have went too high. So it's something that you have to do the blood test, and then you get your blood glucose check from there.
What's the most important advice you can give for a parent who's dealing with what you're dealing with?
Stay strong. It's not an easy disease. Like I said, it's all the time, but you have to stay strong. You have to stay strong whether it's a toddler or a teenager or even adult. You just have to stay strong and be the best support you can for your child and for the family.
And it does not preclude a long and productive and almost entirely normal life.
You can still really go on.
You betcha.
Oh, you can do everything. Good. You can do everything. Yes.
Thank you very much. We'll be right back with more after this.